You know, it's kind of crazy, right? Like here we are with all these medical advancements, but cholera is still around.
Yeah, it really makes you think. And it hits those who are most vulnerable the hardest.
Exactly. So today we're going to do a deep dive into cholera. Really explore how it spreads, the impact it has, and why it just keeps coming back, especially in places that are already struggling.
Right, because for those of us who want to be informed, it's not just knowing about the disease itself.
It's about understanding the bigger picture,
Yeah,
right?
absolutely. Like
Like-
how it ties into poverty, global crises, all of that.
So let's break it down. First things first, what exactly is cholera?
Well, in simple terms, it's an acute diarrheal disease,
Right.
and it's caused by a bacterium called Vibrio cholerae.
Okay, Vibrio cholerae. And how does this spread? I mean, what's the main way it gets around?
Contaminated water and food. That's usually the culprit. And a lot of times, it's because of poor sanitation.
Which makes sense given where we see the biggest outbreaks.
Exactly. So this bacterium, it gets into the water or food, someone consumes it, and then what happens in the body?
Yeah, because contaminated food and water, that sounds simple enough, but then the effects are anything but simple.
Right. So basically, this Vibrio cholerae, it gets into the small intestine, and it starts producing toxins.
Toxins, okay. And those toxins, what do they do?
Well, they mess with the intestinal cells. Basically, they trigger this massive release of water and electrolytes.
So that's where the severe diarrhea comes from?
Exactly. And because of that, you get rapid dehydration. And the scary part is it can be fatal, sometimes within hours if you don't rehydrate.
Hours. Wow, that's terrifyingly fast. No wonder it's considered so dangerous.
It is. And we talked about the environment. There are specific conditions where cholera just thrives, right?
Right. You mentioned poor sanitation. What else plays a role?
Well, think about communities that don't have proper sewage systems or places where access to clean drinking water is unreliable.
So basically, anywhere the bacteria can easily get into the water supply.
Exactly. Whether it's wells, rivers, even the food if it's washed with contaminated water.
And then if you factor in things like overcrowding.
Oh, absolutely. Densely populated areas where clean water is scarce and sanitation is poor, that's where cholera spreads like wildfire. It's a really awful cycle.
Someone gets infected, the bacteria gets back into the environment through their waste, and then more people get infected.
Right, and this ties in with something we talk about a lot, poverty. I mean, it's a huge factor, isn't
A
it?
huge factor, yeah. How so?
Well, think about it. Poverty often means you lack the basic infrastructure to prevent outbreaks in the first place, like proper sanitation systems or reliable access to clean drinking water. We see this in a lot of lower-income countries.
In Africa, Asia, Latin America, you name it.
Right, and then overcrowding on top of that, it just creates the perfect breeding ground for cholera.
And it becomes a cycle, doesn't it? Because the economic impact of an outbreak can then push people further into poverty.
Exactly. Lost workdays, healthcare costs, it all adds up. And that makes communities even more vulnerable to future outbreaks. It's a heartbreaking cycle.
And we see this play out so clearly in specific situations, like what happened in Haiti after the 2010 earthquake.
Oh, Haiti's a prime example. I mean, you had this catastrophic natural disaster, and then on top of that, a cholera epidemic that hadn't been there for over a century.
So the earthquake destroyed the infrastructure, things like water treatment plants and sanitation systems.
Right, and that left a huge number of people without access to the basics. Add to that mass displacement, a severe lack of resources, and you have a recipe for widespread infection.
Thousands died in a very short amount of time. It's just devastating to think about.
It really shows you how vulnerable we are when those systems break down.
And sadly, it's not just natural disasters, right? Conflict zones are also breeding grounds for these outbreaks.
Unfortunately, yes.
Yeah.
Conflict just throws everything into chaos.
Yeah.
Healthcare systems are overwhelmed, damaged, or just completely collapse.
Sanitation systems get destroyed. Access to clean water becomes a daily struggle.
Exactly. And who suffers the most?
Yeah.
The most vulnerable. People are displaced, forced to rely on whatever water they can find, and the healthcare systems are just not equipped to handle it.
So basically, it creates the perfect storm for cholera to take hold and spread rapidly.
Sadly, yes. A good example is Syria. During the Civil War, they had multiple cholera outbreaks.
And the one in 2017 was especially bad. Years of conflict had just decimated everything. Healthcare, clean water, sanitation, everything.
Right. You have all these people living in incredibly difficult, unsanitary conditions, and cholera just thrives in that environment. It adds another layer of suffering to an already horrible situation.
It's like the breakdown of society itself creates these openings for disease to exploit.
That's a good way to put it. And there's another factor that maybe people don't think about as much, climate change.
Oh, that's right. We can't forget about climate change.
Right. It's playing a bigger and bigger role in how often we see cholera outbreaks and where they pop up.
And how does that work? How does climate change affect things?
Well, for one, rising global temperatures. Warmer water means the Vibrio cholerae bacteria can actually survive longer.
So the window for transmission gets bigger.
Exactly. And then you have the increase in extreme weather events. Yeah. Floods, droughts, hurricanes, they all disrupt things.
Yeah, it's like they create the perfect conditions for cholera to spread.
Right. Floods overwhelm sewage systems, contaminate drinking water, droughts force people to use unsafe sources, and hurricanes damage everything. Sanitation infrastructure, water pipes, it's a mess.
And then you have mass displacement on top of all that.
Right. People are forced into overcrowded areas with limited access to clean water and sanitation. It's a recipe for disaster.
You mentioned South Sudan earlier. That was a bad one, wasn't it?
It was. In 2016, they had these severe floods, and it just made an already existing cholera outbreak much, much worse.
So floods, displacement, contaminated water, and then you add in limited health care and widespread malnutrition.
Right, people's immune systems are weakened. They're more susceptible to the disease. It was a tragic situation.
And we're seeing this pattern in other countries too, right? Like Bangladesh, Mozambique.
Exactly. Climate change is making things more and more unstable, and that instability creates opportunities for cholera. It's really worrying.
So given all of this, how big of a problem is cholera globally? I mean, we're talking about millions, right?
Yeah, it's a huge problem. The WHO estimates up to 4 million cases every year and over 100,000 deaths.
Wow. And as we've been talking about, it's the poorest communities that bear the brunt of it.
They do. It's the communities without access to basic health care and sanitation. And we have to remember, these aren't just numbers. These are people's lives.
Exactly. And the impact goes way beyond just the illness itself.
It does. Businesses close down, people lose work, which hurts local economies, healthcare systems get overloaded, so other essential services suffer.
And it hits the most vulnerable the hardest. Children, the elderly, those who are already malnourished.
Absolutely. For them, cholera can be a death sentence. And then you have the social stigma in some communities.
People are ostracized. It adds another layer of hardship. It's just awful.
It really is. But, and this is important, cholera is preventable.
Oh, that's good to hear. It's not all doom and gloom. How do we prevent it?
Well, it comes down to a few key things. Improving sanitation, making sure everyone has access to clean drinking water, and providing oral rehydration solutions quickly when someone does get sick.
Seems simple enough.
In theory, yes, but putting it into practice consistently, that's the challenge. But we've seen it work. When these measures are in place, outbreaks can be controlled and even eliminated.
You mentioned Yemen earlier. That was a good example of this, wasn't it?
It was. In 2019, they had this massive cholera epidemic, but a huge international aid effort really helped to mitigate it.
So even though there was a war going on, they were able to get vaccines out, distribute treatment kits, and improve access to cleaner water.
Exactly. It proves that even in the most difficult situations, we can make a difference. We can save lives.
And speaking of saving lives, vaccines are becoming a more important part of the fight against cholera, right?
They are. Oral cholera vaccines are really vital, especially in high-risk areas. Organizations like the WHO and UNICEF are working hard to get these vaccines to the places that need them most.
Like Haiti, Bangladesh, parts of Africa.
Right. And when you combine those vaccination campaigns with efforts to improve water and sanitation, it's a powerful one-two punch.
So it sounds like tackling cholera isn't just about treating the disease, it's about tackling the root causes, right?
Absolutely. We need to improve healthcare systems globally, work on alleviating poverty, and address the underlying vulnerabilities that make communities susceptible to cholera.
Because climate change, conflict, poverty, it's all interconnected.
Exactly. We can't solve one without addressing the others. It has to be a holistic approach.
So I think a lot of people listening might be feeling overwhelmed right now. It's such a big, complex issue. What can we as individuals actually do?
That's a great question. And it's important to remember that we can make a difference. Even small actions can add up.
Like what? Give us some examples.
Well, first and foremost, awareness. Talk about cholera. Share reliable information. The more people understand the problem, the more support there will be for solutions.
So just talking about it can actually help.
It can. Public awareness can lead to policy changes, increased funding for aid, all sorts of things. And of course, supporting organizations working on the ground is huge.
Like the ones providing clean water, health care, vaccines.
Exactly. Donating to those organizations, even if it's just a small amount, it makes a difference. And supporting local initiatives, too. Anything that helps to improve sanitation and water quality in vulnerable communities, we may not be able to solve everything, but we can contribute to the solution.
That's a really empowering message. Thank you. So as we wrap up this deep dive into cholera, what's the one big takeaway you want listeners to remember?
I think the biggest takeaway is that global health challenges are interconnected. Cholera isn't just a disease, it's a symptom of deeper issues. We need to work together across borders to address poverty, conflict, and climate change. Only then can we truly protect the most vulnerable and build a healthier world for everyone.
Well said. Thank you so much for sharing your expertise with us today. And to our listeners, thank you for joining us on this deep dive. It's through understanding these complex issues that we can all be a part of the solution.
Absolutely.
And on that note, our next deep dive is going to be all about technology's role in fighting global health crises. It's a fascinating topic. We hope you'll join us then.
I'll be there.
Great. Until next time, everyone.
Take care.